What is amblyopia, and how does it affect vision? Imagine a child who seems to squint or tilt their head to see better, but no one notices anything unusual at first. That's because amblyopia, often called lazy, can be sneaky. It's a vision development disorder where one eye doesn't see as clearly as the other, even though it looks normal. The key is that the brain and the eye aren't working together properly. Usually, the brain favors the stronger and ignores signals from the weaker one. Over time, this causes the weaker eye's vision to decline and can't be fixed just with glasses or contact lenses. Amblyopia usually starts in early childhood, when the visual system is still developing. It's the most common cause of vision problems in children, affecting about 2 to 3 children out of every 100. If it's not caught and treated early, amblyopia can last into adulthood. It remains a leading cause of vision loss in one eye among children and young adults. The condition happens when something disrupts normal visual development or the way both eyes work together. The main causes include misaligned eyes, known as strabismus, where one eye turns inward or outward. This misalignment makes the brain ignore the image from the turned to avoid double vision. Another cause is significant differences in refractive errors, like one eye being more nearsighted, farsighted, or having astigmatism. The brain prefers the clearer image, so the weaker it gets ignored. Sometimes childhood conditions like cataracts, which cloud the eye's lens, can also lead to amblyopia. Because the brain suppresses the weaker eye's input, children with amblyopia might have trouble judging distances or depth. They might squint, close one eye, or tilt their head to see better, but often these signs are subtle. Many children don't realize they have a problem until a professional eye exam is done. That's why early detection is so important. When caught early, treatment can be very effective. Treatments aim to encourage the weaker to work properly again. They often include wearing glasses to correct refractive errors, patching the stronger eye to force the weaker one to be used, or using eye drops like atropine to temporarily blur the stronger. In some cases, vision therapy or surgery might be recommended to correct eye alignment. The goal is to strengthen the weaker and improve overall vision. If treatment begins early, most children can recover much of their vision and even achieve normal or nearly normal sight. But if amblyopia is left untreated, it can lead to permanent vision loss in the affected. It's important to understand that amblyopia mainly impacts one, which makes it different from other eye diseases like glaucoma or macular degeneration. Glaucoma involves damage to the optic nerve often caused by increased pressure, usually later in life. Macular degeneration affects the central part of the retina and is common in older adults. In contrast, amblyopia is a developmental issue that happens during childhood because the brain and eye don't develop properly together. Recognizing and treating amblyopia early can make a big difference in preserving healthy vision. If you or your child notice any signs or have concerns, it's always best to consult an eye care professional for a thorough exam and personalized advice.